Hey everyone, it's Michael here at Home Health Success Academy. Welcome to another one of our free video series where we help your hospice, your home care, your home health agency learn techniques to be able to increase your referrals, increase your census. So the question that was asked to me within the past few months, I've had several of these questions in regards to Michael, is cost per clicks, pay per clicks, ads in Google a good thing to be able to get you in the front, on the first page. Of course, those are good things. Those are great things. But the biggest problems is we start worrying about those things, the pay per clicks, those advertisings, and we don't even, approach it the smart ways and research into it or bring in the right type of people to help you guys with those companies or with those type of advertisings, and we end up paying a lot of money but then no return on investments. Now, if you're going to be doing these ads, if you're going to be doing pay per clicks, cost per clicks, I want you guys to start thinking one thing is this, is that when you get them to your web page, your website, are you engaging them? Are you putting stuff or putting information in your website that is going to engage the people to want them to stay longer? Because remember, there's a study that's been made that a lot of people, in regards to when they go to a particular website, if they are not engaged within a matter of 15 to 20 seconds, that they will click out of it. And so, your website cannot be just this typical website like we used to think about, where it's just a virtual brochure where you're going to put all the information about your company, your services, where your coverages are, your phone numbers to reach you, and your address, your emails, and that's it. Your website needs to be able to keep people there longer to get them to start making commitments. You need to engage them. How do you engage them? You have to have some, educational based marketing materials. Are you using videos? Are you using whiteboard animations? Are you doing so many different things to engage them? Are you providing downloadable materials? Do you actually also gather information? Do you have lead pages? Are people entering their information in there so you know who actually visited your website? All these things are very important to be able to have that great website to engage people in. But when we start talking about, Michael, what works best? Okay, what works best in trying to be able to get clients? You have to understand, most referral sources already have and are bombarded with a lot of information, a lot of other marketers out there, a lot of liaisons out there that drops off their brochure. So typically these referral sources are not going to be searching the internet, okay, looking for the next person, okay, the next person that they're going to refer their patients to. Now, baby boomers out there, their kids looking for care for their parents, may be using these ways to be able to find information for care for their loved ones. And so you don't want to just close one avenue of referrals. You want to have a multiple spout of referrals going into your funnel to be able to get you more clients. But typically, when we start talking about internet marketing, it's just a good way to be able to get people engaged in your company, but how do you keep them there? And so when it comes to marketing, honestly, walking in the door cold is a lot better. And, to be able to do it correctly is you want to be able to get those appointments. And when you start asking questions, what works better, calls or clicks, Michael? Calls are going to work better. You're going to be able to engage. It's cost effective. Like how many phone calls do you think you can make in an 8-hour time period, an 8-hour workday? A lot. Okay, are you spending, how much time are you spending on the phone? How many calls are you making a day, in a week, in a month? Okay, and not just the calls, are you actually trained? Do you have scripts? Those are very important to be able to make sure that you maximize your marketing. Just like anything, whether you're internet marketing, you'll be able to make sure that you maximize things, that have the right information, use the right scripts, make sure that things are written correctly. Okay, same thing also when you're making phone calls. Do you have scripts? Okay, can you convert a cold call to a warm call, from a warm call to a hot call? Meaning that, cold call, nobody knows who you are yet. Warm call, they have some form of an idea. Because remember, if somebody literally gets your information in your website, and when they call you, they still don't know much about you. So eventually, there's going to be that conversation that needs to be made. So what I'm trying to do is I'm trying to skip the whole internet thing. I'm trying to go straight to the people that's going to be referring patients to my company. And this is something that you guys should actually work on and actually do, because it's actually very important for you guys to start learning that. So, from my experience, based on my experience and more than hundreds and hundreds of other, you know, caregiver liaisons, other marketers out there that I know of, phone calls is literally the best way to be able to engage somebody, to gain their attention, to gather the information on who you need to be able to speak to, because whoever you get on the phone may not be the person that you need to be able to speak to. So you need to be able to ask the right questions to know who you need to speak to, what would get them to be interested more in you, so that's where you gather the information. So honestly, make phone calls. I challenge you guys, and I can guarantee you guys, if you um, are typical home health agencies that I've seen out there, you probably made less than 10 new phone calls or 10 new engagement calls on a client that you never serviced before in a week. And I've seen other agencies out there who don't even make a phone call a week to a new potential referral source. And so if you can increase, okay, and if you can increase your calls, by 100 calls a week, it's not that hard to do 100 phone calls. 100 cold calls a week is not hard at all. Why is it not hard? Divided in 5 days, that's only 20 calls a day. If you average maybe each call about 3 minutes, because not all calls are going to actually work well. You can just gather the information, send them some stuff. But imagine that, let's say 5 minutes. 5 minutes times 20 phone calls, that's how many minutes? That's only 100 minutes. That's less than an hour. It's about an hour and a half of your day. But imagine the conversion rate if you actually have a script, know what you need to say, know what you need to ask, what you can actually convert to be able to have that actual appointment. So if you can actually make sure that you make a commitment and you actually do something about it, imagine what you guys can actually do. So I want you guys to start looking into that. Cold calling is an amazing thing. Now, a lot of people are scared of calling. A lot of people are scared to literally make that phone call to be able to get that appointment, make that phone call to be able to engage somebody about the products, about their services, about their home health agency, because most of us are fearing rejection. We don't like to be rejected. And you guys have to understand is that this is the business. You may not want to see rejection, but you get rejected every day when people don't use your services, when they decide to refer a patient to another company, right? So that's rejection itself, but it's not being said to you. They're not saying to you no every single day, but it's happening, okay? And so you need to be able to understand that it's okay to be rejected. Just let it be. It's going to happen. It's if you can figure out what is the reason why they rejected you, why did they not refer a patient to you, then you can improve yourself better. And so if you actually have a good follow-up system, and here's just a quick tip, when I follow up clients that I've been, pursuing for so long and they don't use my services, they don't start using my company, my products, my home health agency out there, when I re-engage with them, I will ask them a question. What made you choose not to use my agency? I want to be able to know that so I can improve my care. Because look, I'm going to ask that question 6 months in, 3 months in, if you're referring any patients to me and I've actually spent some time with you. And by me doing this, I could find out more about that company. What did I do wrong? Where can I improve myself? That is what's important that you need to do as a company, is make sure you do a follow-up. But the first things first, before you can even start making follow-ups, you need to make phone calls and engage people. So is it calls or is it clicks? Which one works better? Calls. Calls are always going to work better, because that you can get a gist of what this person's about. You can get the information that you need. The websites that you have, you should have it there, and you should have pay-per-clicks, you should have cost for clicks, but you have to do it the smart way, because I know agencies that will hire one of those companies that call them out of the blue and they start using them, and then all of a sudden this company just wasted thousands of dollars, and nothing to show for. So you want to be able to do it right. A lot of people out there are not as familiar in regards to, pay-per-clicks, cost for clicks. It can be costly for you if you don't do it correctly. But that does and goes for anything that we do in the industry, outside the industry, when it comes to marketing. If you don't do it correctly, it will cost you. But one thing you have to understand, just like in home health marketing is not hard if you know what you're doing. So our goal here at Home Health Success Academy is to guide you, help you, step by step, learn on what you can actually do to improve yourself. So that's just a quick tip. Remember, cold calling is always going to be the best way to be able to engage somebody immediately, engage the people that you want to be able to speak to directly. And if you can't speak to them, gather the information on who you need to be able to speak to, how you need to be able to speak to them. So that's just a quick tip. This is Michael from Home Health Success Academy. Remember, we're here for you. Give us a call, 630-340-8990. Don't forget also, we're having our Home Health Success University out there. If you guys want more information, give me a call. Amazing, amazing information that's going to be able to help your company get the right ideas, where to market, how to market, what to do to engage people. So once again, this is Michael from Home Health Success Academy. First of all, thank you so much, guys, for joining me in another video. Have a great day.